Hello, everybody. Welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, the Thyroid Pharmacist. Today, I'm really excited to be joined by a long term colleague and collaborator and friend of mine, Dr. Anna Cabeca. You may know her as the girlfriend doctor. Today, we're going to be diving into menopause. We all know menopause is mandatory, but suffering through it is optional. So, we're going to go through some ways that you could thrive in your second spring. I'm going to give you a little bit of a background about Dr. Anna Cabeca. She is the best selling author of The Hormone Fix, Keto Green 16, which I personally utilized for quite some time and I love, and Menopause. She's a triple board certified and a fellow of gynecology and obstetrics, integrative medicine, anti aging, and regenerative medicine. She holds special certifications in functional medicine, sexual health, and bioidentical hormone replacement therapy. I always learn so much from her, so I'm super, super excited to pick her brain today. She is sassy, blunt, speaks from the heart, and has a wonderful sense of humor. And this is why we call her the girlfriend doctor, because everybody needs a friend like her. She's also developed some really innovative natural products to help women balance hormones and thrive through menopause, including the highly acclaimed Julva cream, which many of my listeners have utilized and loved. This is for the vulva. It rhymes with Julva, right? And then also Mighty Maca Plus, a powerful superfood blend. She lives in Dallas with her daughters, horses, and dogs. Welcome, Dr. Anna. It's always so wonderful to see you and connect with you.
It is so good to see you too, Isabella. Thank you for having me.
It's really, really my pleasure. I know we've known each other for quite some time now, and have always been really impressed with your knowledge and the attitude and the advocacy that you bring to women's health. In the last few years, you've always been a women's health expert to me, but in the last few years, I really appreciate that you've started to talk more about menopause, which I feel like most women just expect it's going to be a miserable time, right? Like you go through menopause and that's kind of the end. Can you share more about that? What are your thoughts on that?
Yeah, well, I would always say menopause is natural and mandatory, suffering is optional. Like that is a key thing. This is a transition time period and is no more a disease process than puberty, right? It is a transition piece in our life. Now, there's ways to do it healthy and unhealthy, right? And so, understanding for me, it was getting to the root issues. Where are we getting out of balance? How do we create balance? Because if this was a mandatory suffering period, it would be true for every woman everywhere in the world. And so when we look at world medicine, international medicine through my own journey, I realized, okay, we need to empower our body's natural production of hormones, balance them to the best of our ability, and remove things that are causing problems, any of the inflammatory factors, hormone disruptors, toxins, et cetera. And so that we and optimize our body's hormonal reserves as well, whether that's with bioidentical hormones. But usually I will start with nutrition, lifestyle, mindset, herbals, adaptogens, and then hormones.
Mm, I love that. I know a lot of us that share on how to heal, we always have our own healing journeys. Can you share some of yours, perhaps through early menopause and how you became so inspired, so passionate and also knowledgeable about this?
Yeah, yeah, thank you. Well, I was always very interested in women's health because, as a young girl, my mom had heart surgery. She was 52, undergoing bypass surgery. I was 16, and I recognized in looking at the research that the procedure they were in treatment she was going through were based on studies on men. And I was like, okay, there's a problem here. And so I became a women's health advocate from that point and studied part of the HERS trial, if you remember, hormone replacement and cardiovascular disease. I was one of the researchers on a branch of that. Then, again, when the Women's Health Initiative study came out, I was really into understanding the research behind that, as I was also a researcher before I went to med school. So I was always asking why. And then part of my own journey with even with as much as I knew and understanding that there's food is medicine. When I was 39, post traumatically, I was diagnosed with early menopause and infertility, and it failed several rounds of the highest doses of infertility treatments with no results. And so that's been part of my healing journey. It's part of what I do. I took a sabbatical from my practice and, traveled around the world. Went, yeah, as an OBGYN, and I trained at Emory University, one of the best institutions in the world for gynecology and obstetrics. And my doctor's bag was empty. I had this diagnosis of infertility, then the diagnosis of early menopause, told I would never be able to conceive. And that was devastation. We don't think, this was in 2006, okay, that I'll be able to reverse this diagnosis. Like we didn't talk about things like that. But as a result of this healing journey around the world and experiencing some of the healing foods and traditional medicine modalities, so from healing foods like maca and acerola and mangosteen and spirulina. I mean, all these different things started combining that, plus you know, uh, being in nature and so much to that journey. I write about it in my first book, The Hormone Fix. But as a result of that, I came back pregnant at 41 years old, had my daughter, Ava Marie, the child I was told I would never be able to have. So I say, with the grace of God, this journey was an incredible healing journey. So I was on fire now at early 40s, having this child that I was told I would never be able to have, and then integrating these practices and I created the adaptogenic blend, Mighty Maca, with all these foods that I experienced around the world. So integrating that into my practice and of course digging more into hormones. And then as it would be, Isabella, in like 2014, I was hitting that second surge and still PTSD was under the surface. I still hadn't really learned how to address the PTSD. And so all of this came to a head when, like in 2014. So I was uh, 48 years old. 2014, I think, yeah, because I'm 59 this year. So that's that perimenopausal journey where it was rearing its ugly head, mood swings, forgetfulness, weight gain without doing anything different. Like seemed like 20 pounds came on overnight without doing anything different, and like all these aspects. And that's where I really dug into my what I call my keto-alkaline or keto green method to help restore my hormones, release the weight, and focus on the nutritional and lifestyle because it's more than what we takes more than hormones to fix our hormones. And that created my in 2014 bringing my Magic Menopause program online. And that just to help with, again, takes more than hormones to fix a hormone. So these aspects to really empower us as women to feel at home in our body, even in the midst of an incredible transformation of menopause.
Wow, I think you've been so through so much, and it's amazing that you had that training and background already as a doctor and as an OB-GYN as well. And you were able to put together a healing plan for yourself. And now you're utilizing it to help so many people heal themselves. I know one thing I wanted to ask you about is because a lot of women with thyroid issues, they can go into premature menopause as well. Can we share a little bit more about that and what that is and what that might look like, and perhaps some things we can do about that?
Yeah. So when we look at, premature menopause or even, there's the different terminology we've used. We have premature menopause and premature ovarian insufficiency, or we used to call it. Well, I never remember what we used to call it. We had other terms for it, but ovarian insufficiency or ovarian failure, and so I think when we look at this, we look at younger than age 40 experiencing this loss of fertility and in cases of, endometriosis, in cases of thyroid disease, in smokers. I mean, there's different things that are associated with this ovarian insufficiency, these ovarian insufficiency syndromes. So, what we look at is what I look at in these diagnoses. And I always like to tell my clients, your diagnosis is not your destiny. So with these diagnoses, how do we address the entire hormonal? How do we reboot the hormonal system? How do we replenish your ovarian reserves and adrenal reserves? How do we work together physiologically, energetically to help support your body's own natural hormone production again? And taking and looking at that and saying, where are the burdens in the case of thyroid disease and what's causing the thyroid disease between nutrient insufficiency, autoimmune issues, toxins, mold exposures, metals? I mean, really kind of we have to decipher. I'll say, put your Nancy Drew hat on. Let's look for the clues that what is causing this.
Yeah, it's really challenging, I know, for women with thyroid issues because they not only have to worry about the consequences of thyroid disease and common thyroid symptoms, but how thyroid hormones interplay with reproductive hormones. And for many women with hypothyroidism, they might find that perimenopause, they might be well balanced before hitting perimenopause, but then it's like another layer of something that they need to address. Some people have said that perimenopause and menopause brings out a lot of these, I guess, hidden triggers and hidden things that were underneath the surface. They sort of come to surface. Has that been your experience as well?
Oh, yeah. It's a period of really neuroendocrine vulnerability. So it is like when we look at this period of neuroendocrine vulnerability, because in this time period, the symptoms that we see, the difficulty sleeping, the mood swings, the anxiety, the brain fog, the loss of libido. I mean, that with the GYN symptoms, the irregular cycles, the PMS, which is also a neuroendocrine syndrome, and the weight gain and the breakthrough bleeding and the heavier than normal periods, cramping, ovarian cyst, et cetera. So you have the GYN and you have the neurologic symptoms and endocrine symptoms and the thyroid too, also, as so many things affect your thyroid. It's such a key gland. But with this, like this is a period of neuroendocrine vulnerability. And when we look at these pathways, we think, okay, I always look at it this way because when I really meditated on the neurologic symptoms with the endocrine symptoms, because what happens for most people, you come in complaining to your doctor, whether it's PMS or regular periods, and you get offered a birth control pill. And then you get offered a SSRI, Prozac or Zoloft or Cymbalta or something, or Wellbutrin. I mean, you get offered a bunch of different medications to treat these symptoms, and you have difficulty sleeping, so you're getting a sedative at night. And then the list goes on. But if we address the underlying issues that's causing this, number one is as we're aging, while our reproductive hormones are going down, insulin and cortisol are going up. So we have to create lifestyle strategies and nutritional strategies to create more insulin sensitivity and to manage our sleep wake cycle or circadian rhythm cycle. And then we want to replenish our reserves to support our neurologic pathways. And we look at these symptoms, anxiety and difficulty sleeping, two of the most common issues in perimenopause. We look, okay, well, to have a good night's sleep, we need melatonin. To have less anxiety, we need serotonin. And where does this come from? And we need progesterone to maintain tryptophan levels, because from tryptophan, we make 5 hydroxytryptophan, which converts to serotonin, which we make melatonin from. So if we think of that logically, these symptoms that we're experiencing here that are getting band-aided, well, let's just, suppress your ovaries, put you on birth control pills. Let's just give you an SSRI. Let's just give you a sedative to sleep. But if we come up here and say, okay, let's support the ovarian function and adrenal function of progesterone, let's give you the nutrients you need, the B vitamins, the tryptophan, the iodine, the vitamin D that you need. Let's decrease let's get your foot off the gas pedal of life that's pressing that cortisol, you know, speed button and adrenaline speed buttons so that we can have more adrenal reserve and more progesterone. Then all of these symptoms start to resolve. And it's beautiful and you feel better, right? You feel better. And I think about this. I do. I like these are things I meditate on, Isabella. Like, what is happening here? What are the underlying issues? And I would say, like, I'm a lazy doctor because I want to look at the smallest thing I can change and support for you that's going to make the biggest overall difference, right? And that always comes down to the cellular mitochondrial level. So when we do that, we improve the entire hormonal cascade.
I love that. It's kind of crazy and mind-boggling to me as a pharmacist. I used to dispense so many medications, and there was one doctor where me and the other pharmacists would kind of like tease that it was like he put everybody on the old people protocol, and it was like 10 to 20 different medications, right? For people. And I'm thinking they were sleep medications, anxiety medications, they were antihistamines. So we do know there's like a histamine dysregulation issue with perimenopause. And you kind of go through the list of the various symptoms that are treated with pharmaceuticals in women, and you can kind of trace it back and say, like, if we just did some progesterone or some bioidentical hormones, we can, scratch off this prescription, erase this prescription. Not exciting for the pharmaceutical industry and perhaps for pharmacy owners, but how exciting is that for women where they can feel like themselves again without the crazy side effects of, a dozen pharmaceuticals that just suppress symptoms? And it's like, well, progesterone helps you feel more calm. Like, you do not need anxiety medicines, you do not need sleep medicines, and your libido is going to get better. And so many other things are going to improve. Mind boggling.
I completely agree. And even then when we think estrogen's needed to maintain serotonin levels too. So it's this combination when it comes into hormones. But I always look at the first step is always let's clean up the terrain, let's support the adrenal, support ovarian function, your HPA axis, and supplement with hormones as needed.
It's so fascinating. You mentioned insulin and cortisol and how they're changed during that transition period. And we know that insulin is the storage, helps us store fat, right? Which most of us, let's be real, we don't really want, especially as we're going into middle age. So, how can we support our bodies to be more insulin sensitive?
Yeah, so there's a few things. This one is I talk about this. This is one of the basis for my keto alkaline or keto green approach. So it's first with low glycemic foods, lots of good alkalinizing greens, low glycemic fruits and vegetables, your fermented foods. We want to make sure we get those alkalinizers, those greens, those fibers to feed our gut microbiome because there's our estrobolome within us, our estrogen producing and metabolizing gut microbiome. And so that's one key part of it. So those are the alkalinizing greens part. And then part of the keto part is to get into ketosis through high quality protein, healthy fats, and intermittent fasting and no more snacking. Like this has got to be implemented as we age for optimal health. And I say 80% of the time. So we want to maintain this 80% of the time because when we shift, it's so important to understand during this time of this neuroendocrine vulnerability, we're becoming more insulin resistant. And estrogen, progesterone and estrogen are declining, and both progesterone and estrogen relate into the insulin pathway. So when we become more insulin resistant as we age, we and our brain uses glucose as a primary fuel store source because of the decline in hormones, especially estrogen and progesterone. The use of glucose for fuel in the brain is hormone dependent. We know it's estrogen dependent, most likely progesterone dependent too, but shifting to the use of ketones is not hormone dependent. So if we're in this high carb, lots of fruits, lots of vegetables, lots of starches type of diet, our brain can actually be starving for fuel. When we shift into ketones, all those neuroendocrine symptoms go away. They just go away. They resolve. We become more insulin sensitive. We have clearer cognition, better mindset, memory, mood, mojo, all of those good things start to fall into place because now we've become more insulin sensitive. We have jet fuel for the brain, and we're really supporting hormone metabolism in a healthy way, not the traditional keto way. We talked about this, and I love eating with you, by the way, Isabella. You eat this way, and it's so beautiful, right? We want what nature provides in the healthiest ways possible. So, looking at these things, together make a big difference. And then it feels empowering. It's like your choices are making a difference. And it's not something you're relying on externally, like on a prescription per se.
I love your keto green lifestyle approach. I will say one of the things I did to get into remission with Hashimoto's was a modified ketogenic diet without dairy. And then, one of the things that becomes really, really important in perimenopause and menopause is that fiber component, which is missing in the traditional keto diet. So, like the keto green lifestyle is a brilliant, brilliant design because you incorporate all the things that women need. So you take the benefits of the ketogenic diet without the limitations. Because a lot of women, if they just try straight up keto in perimenopause, and I have been one of them, so I can speak from my own personal experience. You lack the fiber for helping with that hormone balance. So this is brilliant, and I know you have a book about this, right?
Yes, I have 3 books. So, first is my book, The Hormone Fix, that kind of covers many of the areas related to hormone empowerment, let's say, and also my story from infertility to reversing early menopause. And then there's Keto Green 16, which is my simplest menu plans. And all my menus are medicinal menus, but a 16-day easy plan. There's a 16-day omnivore plan, and then there's also a 16-day vegan plan in there. All of my recipes are gluten-free, dairy-free, grain free, not green free, grain free. And then because when we do something regularly, we often need to make a pause, right? We often need to change things up, metabolic flexibility, changing things up, incorporating some feast days. So then my third book is Menu Pause. It's 5 different 6-day menu plans that each pause something different. Because, there may be something we have to fix from the gut, from the inflammatory, from the autoimmune pathways. So there's 5 different menu plans in there that each pause something. Like the first one, Keto Green Extreme, it's more of an autoimmune combined keto green paleo type of plan for clients with autoimmune diseases. A really good one to bump into. So all of those work really, really well. And I love to eat. From a family of chefs and foodies and gastronomiques, and I believe food is medicine. So I like my menus are medicinal menus. When I created the menus, especially for Keto Green 16, I wore a continuous glucose monitor for a year to like make sure that all these menus really didn't swing our blood glucose. It really creates a good, stable hormonal milieu. Yeah, thank you.
Yeah, I love it. I love the Keto Green 16 book. So I utilize that myself and I can attest to the recipes being absolutely delicious and also not like making me spend 7 days in the kitchen just to prepare one recipe. When you're a mom and you've got a life, it's like you don't necessarily have all that time to spend. So I really love the Keto Green 16. I put a little link to that for people watching if they wanted to check that out. The continuous glucose monitors, I feel like they can be such a big game changer for women that are adjusting their weight, their energy levels. Do you recommend them for your clients and patients or women just going through perimenopause and menopause?
Yeah, I definitely do. I'm actually, I go into periods where I'll wear one and not wear one. I have the Stilo on now under my shirt here. I'm using the Stilo and I like that one because you don't have to remember to tap it. It just automatically Bluetooths to your phone. So I think it gives us a lot of, I mean, they do give us a lot of good information. For me, recognizing, and I write about this in Keto Green 16, but like I grew up on coffee. I've been drinking coffee since I was a kid, right? And then I was following my, my keto green, keto alkaline method. And I would recognize, okay, I'm waking up with an alkaline urine pH and in ketosis. And then I have my double espresso. And then I'm acidic. Well, I can figure that out because coffee, caffeine, that's kind of acidic. But then I'm bumped out of ketosis. Hold on, there's no sugar, there's nothing in my coffee. So I was like going through this in 2018, 2019. I'm like, what is going on here? Then I realized wearing the continuous glucose monitor that my, cup of coffee, caffeine on my fragile adrenal glands was bumping up my glucose 10, 20 points, and then I experimented with that, a regular day without coffee, a day waking up and getting coffee, and it immediately bumped up my blood glucose level. Zero sugar, right? Zero carbs, double espresso, no milk, no fats, nothing else in it. And so I'm like, those little things make a big difference in your physiology. And you think, okay, let me wait till after I break fast to have my double espresso. So you figure out when you can get it in. And then the other piece was I was getting ready to speak on stage at a conference, fasting, because that's best cognition. I like to speak early morning fasting on stage in ketosis, if possible, clearest brain that way. And fasting, my blood glucose went from, fasting 70s to low 80s to 150 for 30 minutes sustained while I was on stage. And I'm like, just stress. Stress is an obesogen. It is the biggest obesogen. When we figure out where our thoughts are, like driving in Dallas traffic, blood glucose shoots up, like things like that, like remind you, okay, let me take some deep breathing, reset my physiology. It's a powerful biofeedback.
Yeah, it's really fascinating when you can monitor yourself. I know for me, if I was having like a glass of rosé, I would be like, "Oh, now I'm going to go hypoglycemic in the middle of the night and I'm going to wake up like ready to take over the world, right? And like at 3 a.m., but just like very restless and anxious with that low blood sugar and then my cortisol would kick up." And I found that through the continuous glucose monitor. And then the other thing, interesting, you mentioned coffee because I used to be somebody that could drink like caffeine at bedtime and just fall, just sleep perfectly well. The minute that I got into like perimenopause, I can have caffeine at 2:59 and I'll be fine. If I have it at 3:01, I'm not sleeping that night. Like it's just not happening. And we really do need to adjust things for ourselves as our metabolism changes. Sometimes our caffeine tolerance goes down. So that might mean you can't do a coffee anymore, or you need to do make sure that you're eating plenty of food with it to help absorb some of that caffeine. You might need to switch to a matcha or, a black tea. These days I like matcha and black tea. For a while I was like, I feel great on coffee, but then after a certain point I was like, yeah, I feel okay. I feel good, but then I'm just not going to sleep tonight if I have it. So
Things that change with our physiology, the wine tolerance, the coffee tolerance, like, okay, that's terrible changes.
yeah, terrible changes, but I think I like your approach to it with monitoring yourself and figuring things out. So, one of the tools that you use is a continuous glucose monitor, which are, very trendy and for good reason. I think they're incredibly helpful. You also utilize ketone monitoring and then um, urine monitoring for alkalinity. Can you tell us a little bit more about that? Because I don't think most people know about doing those things and how beneficial they can be.
Yeah. Well, as physicians, we're trained as gynecologists specifically, everyone who comes into the GYN office, we do a urine dipstick, right? We're looking for infection, white blood cells, but on that monitor is pH and ketones. Always as part of that urine test strip monitor, but we really just started ignoring it over the years. When we look at urine pH, and I look at this in my clients in practice, and I have all my virtual communities checking urine pH as the one of the most important biomarkers. Because when I started, like back to 2014, when I was like figuring out my keto alkaline, keto green method, I was, going straight ketosis. very carb restricted. I wanted to lose that weight, but I didn't like how I felt. So I did what I told my patients, let's check your urine pH. Let's see if let's see where it's at. And I was as low as the pH paper read, which was a 5. And I'm like, I'm just peeing acid. And like, that is not good for my bladder. That could lead to incontinence issues, infection issues, et cetera, long term. Like, I don't want to destroy my bladder. But more importantly, that's a big aha. Oh, my body's inflamed. My body's not at peace with itself. And cortisol, even if you're eating great, like we need the greens, the nutrients, the electrolytes, hence the keto world started. Let's add electrolytes into your water. We've got to add electrolytes. Let's LMNT and salts and trisalts and all this stuff in between our meals, right? We want to add electrolytes to our water. Well, part of that reason is this acidity issue, and that relates to the cell membrane, the electrons crossing over the cell membrane. And where our blood pH doesn't change, our urine pH is a biomarker. And so the more acidic your urine, the problems associated with metabolic disease, hypertension, diabetes, inflammation, cancer. More alkaline, 7, I will say aim for a pH of 7, urine pH of 7, and see what gets you there and see what kicks you out of it. And I like you to wake up and go to sleep with a urine pH of 7 and see what happens there, but test throughout the day. After a workout, you'll go more acidic. After you're laughing with girlfriends, you'll go more alkaline. You can eat the perfect alkaline green veggie meal, but have an argument at that meal and you'll be more acidic. So, cortisol increases hydrogen ion secretion. So, we have to understand how our thoughts affect our physiology, how our mindset affects our physiology, how our internal peace or and neutrality affect our physiology, how our joy affects our physiology. So that started to be incorporated into my keto green and keto alkaline method. Goes beyond what we eat. Incorporating how we think, how we behave, how we interact, how we appreciate, all of those things have a physiologic benefit beyond the food we eat.
That's just so fascinating because I feel like that's one very simple, inexpensive thing people can do to check in with their bodies and check in with themselves throughout the day. And it's like you don't have to go to the vampires. You don't have to like make a special appointment. You can just utilize these in your very own home and see if you're at that optimal alkaline level, right?
That's part of the detective work. Like, you're looking at clues. I was saying the Nancy Drew work, we, put our Nancy Drew hat on, see what's happening because it can be very surprising. And the other thing, too, for our keto world and our carnivore world women is that that's very acidic. So we can see when we bump into we can be alkaline, 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 bump into ketosis and go very acidic. Well, the trick is how can we get a little bit of alkalinity with those ketones at the same time? And that physiology is, I mean, it's like really beautiful to experience. And so just to be aware of that too, because if you're in that high keto state, high fasting, high carnivore state, that can be very acidic in the long term. Let's check what's it doing to your bones? What's it doing to your muscle mass? What's it doing to your immune system? And I know, from watching these markers over time in clients, that shifting, really paying attention to that alkaline urine pH. I'm telling you, it is game changing.
Yeah, thank you so much for sharing that. I know carnivore and keto diets can be a bit more trendy these days for people with autoimmune disease, and for good reason, because a lot of people do see improvements in their symptoms. But then there's, of course, the unintentional consequences if you're not properly addressing your electrolytes or if you're going too acidic. And sometimes I feel like a short term you might see a short-term benefit of being in that acidic state, but in the long term, that's where it can get detrimental and lead to a lot of the challenges, right?
Absolutely.
We mentioned oxytocin. Can we get into oxytocin? This is our love hormone, our bonding hormone. What role does that play in feeling your best when you are in your second spring and just throughout your life in general?
Oh my gosh. Like, I love what really recognizing for me, and I write about this also in my book, The Hormone Fix, the cortisol oxytocin connection disconnect. So really, when we are and it's really important to understand. So, first, oxytocin is the hormone of love, connection. It is the most alkalinizing hormone in our body. It's why you can have a night of being raucous, having fun, and eating some of the most alkalinizing foods, and yet wake up very with an alkaline urine pH. Oxytocin is very alkalinizing. It is also, like, when we think of this, it's the oxytocin is a hormone of pregnancy and labor and delivery. It's this attachment hormone. It's a hormone of orgasm and intimacy and pleasure. Again, an attachment hormone. Again, very alkalinizing to our physiology. It's like an it is that really, like, all things beautiful. And so, connection, love, trust, giving, philanthropy, joy, play, laughter, playing with pets, getting out in nature, doing things you enjoy with people you enjoy doing them with increase oxytocin. Now, oxytocin and cortisol counter each other. So, in my story, it was PTSD. And as much as I intellectually rationalized and powered through, etc., the PTSD physiology for me was under the surface. And what happens here is when you have a stress event, acute everyday, chronic everyday stress, or acute stress, such as in post traumatic stress, and those with adverse childhood experience, you have this physiology where the cortisol gas pedal's been pressed for a long time, and your neurologic system, the paraventricular nucleus in the brain, says, okay, cortisol, you're frying me out, stop. And it suppresses cortisol. So now you get into the state. Well, first of all, when cortisol's up, oxytocin goes down. When you're in that fight, flight, freeze, escape mode, you are not connecting, right? It's not that time of connecting, nurturing, bonding, loving. So you're in this fight, flight, freeze, you're in this high cortisol, oxytocin is low. But when it's up for a long time, our physiology, our PVN suppresses this cortisol. So now you're in this physiologic state. And I think this is one of the most dangerous physiologic states that we can be in. And it's when cortisol is low and oxytocin's low at the same time. This is the physiology of disconnect, physiology of depression, isolation, divorce. This is the physiology that says, I love my kids. I just, don't feel like being around them. I love my spouse, but I know I love my spouse. I just don't feel love for them. Or I love my work, but I'm really feeling burnout, right? It's a physiology of burnout. Things you used to love doing, you're no longer doing. You love gardening, you don't feel like doing it. You go into the store, you see a friend that you've known for 20 years, and you're like, I'm going to pretend I'm invisible. They don't see me, I don't see them. It is a physiology of withdrawal, and it's a very, very dangerous physiology. And so when we work, like, and then I do this in my program, say the oxytocin is the most powerful, most alkalinizing, the most healing, the hormone of longevity and rejuvenation. So everything we can do to increase oxytocin, that's our focus. Like, I don't talk, I rarely say stress management. I thought stress management is very stressful, but let's do what are things we can do to play today? What oxytocin increasing snacks, I say oxyplay snacks, can we do today? How can we play more? What's bringing us pleasure? Where do we see love, gratitude, laughter in our life today? Focus on these things. What's bringing you joy? And then we're increasing oxytocin and naturally resetting our cortisol and circadian rhythm. We're changing our physiology. And I prove this over and over again because I have my clients checking their urine pH, and now you go from the stress physiology to an alkaline physiology beyond what we're eating. There's a combination here, but it's powerful to see that happen. It's empowering, I would say, to see that happening. That's within our control. And what that helps us do is shift into this place of neutrality, especially in perimenopause and menopause, when you feel like, look, I have no capacity, I have no tolerance, I'm easily irritable. And I've said it, and my clients have said it. Where did this monster in me come from? Right. So we want to be able to respond, not react or overreact. And so that comes from being in this place of neutrality physiologically, less inflamed, right? More alkaline, less acidic. And it just makes a difference. Not only do you become more magnetic and enjoying those around you, but they enjoy being around you too.
It's really, really quite fascinating, and I love that you're tracking the biomarkers with this. I think you're so spot on with the low cortisol and the low oxytocin. I'm sure people watching are having light bulbs go off. Most people, it's so interesting because people talk about cortisol, and high cortisol is a challenge. We're always trying to lower our cortisol. And I think that's great advice for the average person. But a lot of the women that I've personally worked with autoimmune disease, with chronic fatigue, with fibromyalgia, with Hashimoto's, they actually have that low cortisol. And they're also not having the enjoyment in life, right? And so they're having that. I think the anhedonia is one of the terms for it. That's more of the clinical term, where they're just like, yeah, I love my kids, but I just don't feel anything. Or I love my parents, but I just don't feel anything. And there's a lot of shame that comes from these feelings. These are some of the conversations I've had with women where they're like, this is like the worst feeling. Like, I could deal with the fatigue, I could deal with all of this. But in my early training, and I had low cortisol as well, a lot of it was like, let's use supplements, let's use hormones. And then over the years, I've started to work with people that are like, I can't do hormones, I can't do supplements. And so I'm always being creative and being like, okay, how can we help you naturally? And those pleasurable activities that you talked about, a lot of times I've seen women coming out of like deep, deep fatigue. And we haven't done pH testing. I think we'll have to start doing that, and they will be like, I'm just not tired anymore. And I went to like Marshall's with a girlfriend and really found the joy in that, or just finding the joyful things, and that improves the oxytocin, and that balances the cortisol naturally. Because for a while it would be like you'd have to put somebody on supplements for 3, 6, 9 months to see their cortisol patterns normalize. And sometimes just with their changing of, their day-to-day life, instead of focusing on like the things I have to do, we're now doing the things I love to do. And that is such a huge game changer.
And I think it's like that prescription. What are you doing for fun? And I do that. I challenge my patients. What are you doing for fun? Do something for fun. And I had this client with chronic anxiety, and I'm like, okay, you've got to do something. What do you love doing? She goes, I used to love dancing. And she came back in for her follow up, and she was just like, felt better, lost some weight, was really happy. And she said, Doctor, I said, what did you do? She said, I started taking dance lessons again. And so that is the power of oxytocin, right? We can focus on, and I did it too. Like, okay, we're all these supplements, and now I find, okay, let's support our adrenals. And for me, that's like foundationally the Mighty Maca Plus, right? The adaptogenic blend that I've got in there. Work on things and microdosing oxytocin throughout the day. How can you play? How can you have more fun? What are you grateful for? How can you laugh at yourself and laugh at situations more? How do you know, like that? That is, I mean, that's the art of healing. I think really that empowering oxytocin piece is the fastest way to heal those adrenal glands.
Yeah, absolutely. And I like to think there's like this meme going around of like an old Italian man who just like sips wine by the ocean and plays cards with his friends. And I think, this day and age, we're thinking of all the longevity hacks and all the things we can do, but just doing the things you love can be such a powerful game changer.
Mhm.
Sexual health and libido, a lot of the times, we know that's going to boost our oxytocin, but there's just this like block of like, I used to enjoy this, but I'm not enjoying it. I feel like I should enjoy it. And then some of us can get really into our heads. We do know hypothyroidism, menopause, perimenopause, hormonal imbalances, high cortisol. There's like a million things that can really mess with our libido. And having a healthy libido is part of, I feel, being a healthy person and just enjoying life. And I mean, if this is something that most people, I think, could benefit from, right? Can you talk us through that, how to get that optimized? And
Oh, yes. And, it's one of those things like, intimacy, connection increases oxytocin. It helps you reconnect and communicate better. And for women and men, it's different. When, as a gynecologist, and, one of the, survey my patients, 70% have issues with libido, but they won't bring it up unless you ask. And it's usually as a gynecologist, your hands up on the door, you've done your annual exam. You're like, okay, I'll see you next year. Is there anything else? Oh, but doctor, I have I don't have no sex drive. I'm like, that is a 5-hour discussion. So I did create a very holistic program called Sexual CPR. Fun name, very holistic. I am the sexual health expert, not relationship or technique expert. So I bring in some of those experts. But anyway, just to give you that disclaimer, very holistic, because there's so many issues. And as I've been doing, and I created that program in 2011, revamped it a few times over the years. Last year, updated it again. But it is one of those, and one of the key things that I recognize is that when it comes to issues of libido, of sex drive, of reasons we're not intimate and we want to be, it comes down to three things. It's issues of desire, issues of disconnect, and issues of discomfort. In the perimenopause and menopause, the vaginal dryness or increased risk of infection, odor, urinary tract infection after intercourse, um, are negative feedback, right? If you have discomfort or pain every time you do something, why would you want to? And understanding that as our anatomy, and I say the most important anatomy is clitoris to anus, perineal anatomy, and including the vulvar vestibule into the vagina, this entire external aspect, especially, is well innervated. The clitoris itself has over 9,000 nerve endings, and that will atrophy as we age unless we're doing something about it. The same with bladder symptoms, bladder incontinence symptoms. So, that is, as a gynecologist, I worked with compounding formulas to really fine tune, and then created um, my own product, Jolva, to combine plant stem cells from the alpine rose with DHEA to use externally to help nourish, moisturize, and improve the sensation of that area. And it's just game changing. And so that's one of the things that we do not have to suffer through and live with. And it is just empowering that area. I can think as a gynecologist, I did so many GYN surgeries, so many bladder incontinence surgeries. And as we really started to fine tune this, I would say rarely, like 98% reduction in the need to do any type of pelvic surgeries.
Wow, that's fascinating. I know I had shadowed some compounding pharmacists during some of my rotations and then after pharmacy school. And I was always fascinated to learn that they had solutions to problems that conventional medicine didn't. When we think about, I just did a continuing education course a few years back, and it was about some like libido medication for women, but it like made them more depressed and tired, and you couldn't drink alcohol. And it was like all of these side effects. And then you maybe had like one more instance of having libido. And then these compounding pharmacists were like, this is what we're using. And the patients would be coming in and they're like, this is a really, really big game changer. And so you've made this available to people. And they can actually go to jolva.com, I believe is the website for getting a free trial. So, can you talk us through that? How old would a person like? When should you start it? How do you use it? And then perhaps some of the. I wanted to pick your brain a little bit about DHEA because feel like a lot of healthcare practitioners are a little bit afraid of it. But there's different ways to use it, different dosages, topically, orally, all of that. So I would love for you to give us a little bit of insight on that.
Yeah, one DHEA sulfate in the blood is one of the important biomarkers I look at too. I want to optimize our adrenal function. We know higher levels of DHEA are consistent with resilience, a better immune system, and longevity. So, where I focus is first and foremost the lifestyle issues, right? Increase oxytocin, the adaptogens. So, like with the Mighty Maca Plus, vitamin C, B vitamins to help support the adrenal. So, your natural production of DHEA, and then to supplement with DHEA. I do it topically. And the reason I got into topical is because, physiology, genetics, et cetera. I take oral DHEA and I will get acne, breakouts, and lose hair. I'm not doing it. And so I had, really navigating, and especially the science behind DHEA, the work done out of McGill University, um, by Dr. Ferdinand Labrie, looking at DHEA intravaginally for helping. And then, of course, in my functional and GYN world, learning using testosterone and DHEA and estrogen vaginally. And for me, topically, before I did surgery, I started using these using prescription doses of testosterone and DHEA before I operated on someone, so I would have good tissue to operate on. And then they would come in, like I would start 1 month, 2 months earlier. My patient would come in for their pre-op and say, Dr. Ann, I have no more incontinence. I'm having the best orgasms in my life. Like I ran 5 miles without a panty liner. I'm like, I don't need to do surgery then, right? So I started working with this and this combination of topical, especially again for women and for men too. DHEA topically on the testes, on the penis is very beneficial. This area in the perineum for both men and women is very vascular. So it absorbs hormones very well. At the cellular level, according to the research vaginally with Adam McGill, it converts to testosterone and estrogen at the cellular level with very little systemic effect. And now, when it comes to systemic effects, I think we worry more about DHEA than we need to, but I don't like to have suppressive forms. I think hormone replenishment. I don't want to replace what your body is producing. I want your body to continue producing as much of everything you need to produce as long as possible, right? So we want to give you the good substrate to continue making, but then support as we need to as we age. So I think that's one of the biggest things. Optimize it through the adrenals, optimize through the ovaries, but in postmenopause, really focusing on that adrenal support, that adaptogenic support, lifestyle, oxytocin increasing behaviors, best thing we can do for our adrenals. And then, supplementing as we need to. So with Jolva, the plant stem cells from the alpine rose, very beneficial in so many ways. The research has shown incredible benefits with that for improving collagen, reducing the appearance of fine lines, and alpine rose plant stem cells have been shown to be antiviral, which in the GYN area is important for me that we have this a little extra bonus from this combination. And then DHEA in general, helping reverse the hands of time. I've had clients in their 70s now. I have some clients in their 80s that have been using Jolva for a number of years. And as well, when it comes postpartum, a course of Jolva can help rehabilitate the pelvic floor quicker and heal from episiotomies, from the laxity, from the trauma of childbirth. I wish I had it and for each of my four big babies, but I learned this after the fact. And so, and actually did a work with a clinic who had, and they started using it in their postpartum women's they have a clinic for women who have female genital mutilation. So female circumcision, et cetera. And they tear terribly, during childbirth. So they started to use it pre-partum and postpartum for these clients and had just tremendous testimonials. So it really is very, very healthy and beneficial for that. And then if you're on birth control pills, having vaginal dryness issues, discomfort, we want to support the vaginal hormonal balance, the pH, and not to forget to replenish the vaginal microbiome. And that's with good Lactobacillus crispatus species and to make sure that we have that good defense mechanism, especially post menopause and as we age, because the more alkaline that pH instead of acidic, which is healthy, the less lactobacilli, the increased risk of infections and cervical cancer. So we want to, if we know that we can avoid these things, let's do it, right? An ounce of prevention's worth a pound of cure. I say this is, vaginal health, sexual health is more than about sex. It is about our health span.
Yeah, absolutely. Fascinating. So you said that DHEA can have topical rejuvenation benefits. I know I first learned about DHEA as the anti-aging hormone, And I have used it for people in supporting the health of their adrenals and just helping with getting autoimmunity in remission. It has been tied to lowering thyroid antibodies. It has been helped with premature ovarian insufficiency. Some women can have healthy pregnancies after that. Now, in my experience, I have seen people with do some people do okay with really high dose, some people just really need a microdose, and then some people can't even tolerate a microdose which is like, 1 to 3 milligrams a day of DHEA. That might even be too much for them orally. But the topical approach is incredible because it bypasses that um, first pass effect. So it doesn't get, you don't get all the androgenic side effects. What I mean from people not tolerating it, they might have back knee or they might have chin acne or hair growth where they do not want it, hair loss from the places where they want hair, um, sometimes irritability. But I love, the topical approach. And I believe like you said, the perineum and the vaginal area is a really, really good place because it doesn't necessarily get into systemic circulation. And so it's safe if you're pregnant and you're breastfeeding as well.
I would say postpartum, it's safe topically, just in the vulvar vaginal area. Wash your hands really, really well. You don't want exposure. In this clinic, because the female genital mutilation tear terribly, they used it prepartum. So I wouldn't use it in general prepartum, like, in pregnancy, but postpartum safely, you can use it topically in that area is very healing. And, it really helps the vulvar vaginal area bounce back and not deal with the incontinence issues postpartum, et cetera. But wash your hands really well. You don't want to transfer it. It is a small dose. The combination is great, but because it does have DHEA, we want to be really careful we don't get that on our babies. But again, very, very safe to use topically in the vulvar vaginal area.
I love that. I definitely, I will say some of the postpartum surprises for me were like, you sneeze and then and then you basically wet your pants, right? You're like, when did this happen, right? And so to have that as a tool to recover from giving birth is incredibly helpful. And I know there's also pelvic floor therapy, but then you have to that's a lot of work to go and do all of that. If you can just use a topical, um, inquiring minds want to know what's a good age to start Julva if we're maybe for women like just preventatively and I just see so many women in their 60s and 70s with incontinence issues, right?
Yeah, yeah, definitely. And it starts early. So I would say in general, and it depends. Like if you start to see fine lines and wrinkles or you're Botoxing, start using Jolva. I mean, that's it. So those fine lines and wrinkles, because if the changes, we're losing collagen here, we're losing it down there. And that affects the urethra, that affects the clitoris. Now in gynecology, and I go to a lot of gynecology and sexual health things, and this is one of the things. Oh, well, when there's atrophy or adhesions of the clitoris, we can lyse them, cut them, cauterize them, except like if you start using hormones, you won't get that, right? You won't get to that degree where we need to be cutting tissue away from your clitoris. I promise you. Like that is, for me, that is barbaric. And when I have a client with adhesions, we do the same thing. We do Julva, we'll increase it to twice a day, and I'll monitor her. And I haven't had to operate or lyse any tissue in a decade. So it can make a huge difference. And the same with the vulvar area. And again, I see clients. So it's part of a preventative health cosmetic routine. We're taking care of here, we want to take care of there. So I'd say 40 and beyond. Yeah.
So 40 and beyond, and this is like a daily application.
Daily application. Mhm.
I saw you had a kit that was like the it was like the lip gloss for like both of your lips.
The lip duo. So I was using Jolva like for my lip lines when you notice I was having red lipstick, I love my red lipstick. So I was having red lipstick bleed line. And I had been at like a Lancome counter and she said, "Oh, well, you need this wax to get rid of these lip lines. Put this wax on and then put your lipstick on." And I was like, what? I'm like, I'm going to start using Julva. So I started using Julva and it like resolved my lip lines and my lipstick bleeds. They weren't happening anymore. And so I started telling my girlfriend doctor community and my club members, and they were like, Dr. Ann, I can't put something for down there up there. I'm like, look, it's edible. I'm telling you, you can have oral sex, you can do whatever. But okay, let me come up with a lip formula. So I call it Kiss, Julva Kiss, and it's more of an ointment, and you just use it once a day and it really helps reverse chapped lips, helps those fine lines and wrinkles, helps the lip puckers that, like many women, like I would, many women get as we get older, the loss of volume around our lips. So a treatment once, you can use it multiple times during the day, the lip kiss, but using it regularly as part of your routine is very, very beneficial. Cosmetic wise, I don't know, maybe I'm sure there's a function issue too, but stronger kisses, I don't know.
That's incredible because I know a lot of women will get filler for their lips as we get older, we lose some of that volume. And so there's like tiny doses of DHEA that you can put on your upper lips as well.
Mhm. Yep, yep. I say at the girlfriend doctor, we take care of your lips above and below your hips, so yeah, these little things like at, 59 years old this year, it's like the little things I think that you start becoming aware of. And then I'm like, okay, what would I have done, 10 years earlier, 20 years earlier? Let me make sure that we're educating around this and it's never too late. So
Where can people find you, connect with you online if they wanted to work with you or maybe get into some of your programs, read some of your books? Please let us know.
yeah, easy to find. It's dranna.com. It's so DRANNA.com. And I love hearing from you. I'm also at the Girlfriend Doctor on social media. And my books are available anywhere books are sold and an audiobook too, if you engage in listening. Doing that a lot more on my walks now, listening to audiobooks. So the Hormone Fix, Keto Green 16, and Menopause. And I'm at dranna.com. I have tremendous resources. And I have the Girlfriend Doctor podcast. I've had Dr. Izabella Wentz on and great resource. Isabella, I've got to have you on again. We've got to talk so much more. Fertility, thyroid, all this good stuff.
Yes, I would love to have you on for part two as well. This has been super, super fascinating. I know I learned a ton. So I'm actually excited to start incorporating some of these within my own life and with my own clients as well. So thank you for sharing that. Okay, question for you. If you could debunk one myth that women in menopause are have been told, what would it be?
I think the big thing is, and we started out the discussion this way, menopause is natural and mandatory, suffering is optional. It is not something you have to power through, and it's not something you have to live with. You don't have to have low libido and incontinence and hot flashes and just power through. And I've seen clients in my online communities that have been powering through for 20 years without resolution. We can reverse these symptoms in as little as 2 weeks. It really is, your body is incredibly powerful. And, and if you're listening to this, you were brought here for a reason. There is hope. There are answers. And, I think that's the biggest thing is keep doing your detective work. Keep looking. Just because, you know, people around you are suffering doesn't mean that's your destiny too.
Thank you so much for sharing that. And then if you had the supplement police come to your house and they were going to take all of your supplements, but you were allowed to keep just one. Which one would you keep?
The mighty maca, without a doubt, you could not pry that away from me. That has been, yeah. And it's 30 superfoods in one. So I feel like I really win with that one. Yeah.
That's such a fabulous blend that is just so supportive overall.
Thank you.
Dr. Anna, thank you so much for being here with us. You're a wealth of knowledge. I just love the energy that you bring and all of the healing and joy that you bring into women's lives. You're changing lives on a daily basis. And thank you so much for all the work that you're doing.
Thank you. Right back at you, Isabella. Thanks for having me.
My pleasure. Everybody listening, I hope this has been a healing conversation for you and this will help you on your healing journey. Until next time.